everybody.
Hi guys.
Hi guys. Good evening. We'll just wait for some more time until we get a little more audience and then we'll start. Hi guys. Thank you for joining. If any of you have any questions or queries regarding hair transplant, you can post your questions here and we will be answering them shortly. Hi guys. Hope the internet is good. Hope we are visible and audible. Shout out in Hyderabad. Hi guys. You can start commenting your questions. If any doubts or anything in general in hair, you can just shoot it out and we will be answering it shortly. Okay, so we'll start. Okay. Hi guys. We are the surgeons from Max Hair Clinic. We are a hair clinic and we've been in this industry for 18 years. We're entering our 19th year now, and we have been successful in treating all kinds of hair problems, be it clinical or cosmetic. From the initial stages, both young, old, men, women, we have been successful in treating all kinds of hair issues. So today the topic which we have chosen for discussion is the hair transplant. So we had put a poster yesterday asking for if any of you have any questions regarding, you could comment and we would be answering it today. So we actually got a lot of questions from that poster. A lot of you had asked a lot of questions, not just about hair transplant but about hair in general. So we've picked a lot of questions were repeated though. So we've picked very questions which was most asked. So since this is going to be a 1 hour live, we will be trying to finish everything as soon as possible. So the most common question asked, I think it's a question asked for all the surgeons. We are a panel of about 15-16 surgeons and we are currently now in the Chennai branch. I'm Dr. Nikita. This is Dr. Kanchana.
Hi guys.
And that is Dr. Meghna.
Hi.
So currently we are in the Chennai branch, Chennai Nungambakam Max Hair Clinic, and we've got a couple of questions, and I think the most commonest question asked was, what is your toughest hair transplant case? So do any of you want to answer? What is your toughest hair transplant?
I think you should be the one answering this question.
I think for me the toughest hair transplant was curly hair. I mean, when a hair is really curled, your tools are all straight. So when you're actually going in a certain depth which is not precise, you're going to cut the hair follicle. So I think curly hair was, I would say tough, but now, I mean, since we are in South India, we have a lot of frizzy curly hair. So we're kind of used to it now, but yeah, curly hair is one of the toughest hair transplant I think I felt. You guys want to say something? Yeah. Okay. So, you want to shoot a question from yours?
Yes, doc. So how can I prevent going for hair transplant? So I would suggest patients or usually for the general crowd to start taking care of their hair from the beginning. Right from when you notice that there's thinning, that's the first earliest symptom that you can notice that you're on the way for hair fall. So I would say that start dropping the consultation for a hair clinic, where we will suggest you what is the best for you, where we can tell you that what are the preventive measures that you can go take before we can enter the stage where you'll have to undergo a hair transplantation. For example, you can start using taking PRP sessions, which is the earliest way to control your thinning. So, and then we have other treatments such as mesotherapy and OLT sessions, where it will improve your blood circulation towards your scalp. It will cut down the accumulation of DHT, which is dihydroxytestosterone, which accumulates underneath your scalp, where it cut down the blood supply to your scalp region. So that's the reason why you will notice all this thinning and frizzing of hair to begin with. So yes, so we have treatments where we can start like first, it's the earliest sign is to pick up what's wrong with your hair, and then just enter a clinic and take the earliest retention programs possible.
Yeah, that's a really good choice. Your last option, you have to save whatever hair you have, like because your donor, which is the back and the sides and beard, is very limited reservoirs. So I would always say that keep that for the last, and it's very precious, it's very priceless. So when you have your initial stages of thinning or frizziness or breakage, you have to address it at the initial stages, and don't wait for you to completely lose your hair and your scalp exposure and then go for hair transplant. So that is a very good question. I think just now a question popped up. Hi Mr. Vivek. Hi Vivek here. I'm planning for hair transplant next month. Will there be any side effects in the future? How long will it take for regrowth once the transplant is done? Okay, hi Vivek. Thank you for joining. You can definitely go for a hair transplant next month, provided your scalp exposure is towards a very large a stage where you can't go for retention program and your restoration program is your only choice. Side effects, there is definitely no side effects when it comes to hair transplant, provided you do it in a very good clinic, experienced clinic, a certified clinic, and the surgeons performing for you are certified and experienced surgeons. Because now currently, especially now at this stage, there's a lot of clinics, lot of places where they do hair transplant. Like I heard there are surgeries going on for like 20,000, 30,000 rupees and all, and it's not quite safe, because imagine for that cost what tools they'll be using and what kind of surgeon or technician or whoever doing, like how would they perform it. It's not that safe. So always make sure you go to a really good clinic and you do your research. You see their backlog of patients or their recovery, and check all this before you go for the procedure. You can always trust Maxa Clinic, because you can see that we've been here in this field for 18 years, and we wouldn't be here if we were not providing good results. So you can always trust us. You can walk and come for a consultation, check out our other clients, their work, and you can check the OT. We're actually sitting in the OT right now. We had a surgery this morning, and the surgery just got over, and we were just cleaning, and yeah, this is it. So side effects, no. Before you go for the procedure, there's a long list of blood tests which you'll be taking, ECG, and we'll be giving you test dose and all those kinds. If everything is alright, then we will go ahead for the procedure. So you will not have side effects. Even after the procedure, you have a set of antibiotics which you'll be taking as per the doctor's prescription. And how long will it take for the regrowth to start? Any of you want to answer?
Yeah, so for regrowth, so what you will expect after the surgery regarding regrowth? So usually if we are targeting from your hairline till crown, the first initial changes you will start noticing is in your hairline. So the first 3 months, so hair usually undergoes a cycle where it starts to shed and then rest and then grow. So first after surgery, what you will notice that you will see shedding of this transplanted hair and then resting and then regrowth. So it usually takes about like 2 to 3 months for you to notice the initial growth in your scalp. So after that, yes, gradually it picks up, and the first visible changes will be seen in your hairline in the first initial months, which is 2 to 3 months, and then as we go behind, the area becomes larger, which is your vertex in your crown. So it usually takes about like 4 to 5 months for your vertex to show up, for the initial growth I mean to say, and then for about like 5 months in your crown area.
Vishal. Hi Vishal. My wife has been losing hair on a regular basis. She's been worried sick. What can be done to fix this problem? So if women have hair loss, there are so many other reasons where hormonal issues come into play. So it is always good to meet a physician, a dermatologist, a trichologist before you take any kind of procedure or any treatment. Before you start any treatment, it is always good to get a long list of blood tests done and proper consultation where they check your scalp and your hair and everything related. and based on the stage of hair loss, your doctor would prescribe the right treatment for you. Hi, I am planning in Max hair transplant, and one more question, will there be any hair fall once the transplant is done? No. Hair transplant, the transplanted hair usually does not fall because the transplanted hair is resistant to something called DHT. DHT is the main blockade, or whatever you want to say it in the layman's term, something which actually causes your hair to fall. It goes and blocks your blood circulation, which in turn miniaturizes your hair follicle, and then your hair starts to fall. So transplanted hair is actually resistant to DHT. We take it from the resistant zone, which is the sides in the back. So probably for 20-25 years you will not have any hair loss. You will have thinning because it's a stage of aging. So you would need maintenance in the long run, but as such your transplanted hair is not going to fall as soon as possible.
And fear of hair transplant, is there any alternative method of hair regrowth treatment, ma'am? So, you guys will answer this question.
So, alternate for hair transplant, there is no alternative, but you can save your hair from reaching the stage which is required to go for hair transplant. Like you can save the hair which you have, because once you lose that hair, your scalp gets exposed and then you have to go for hair transplant. So you can prevent that stage from happening by going for retention programs. In Max we have PRP, we have oxygen laser therapy, we have mesotherapy, we have scalp detox, we even have the QR678, which is the most popular and trending treatment right now. It's really good, you guys should try it, we have it here. And
we would actually, if the patients, if they have reached the stage where they'll have to undergo hair transplantation, then there is an alternative way for that in Max Hair Clinic, which is the cosmetic hair system. We are actually giving desirable looks, the most natural way for the patients to look at themselves in the mirror. And definitely we have an alternative method. If not, if you have actually reached the hair transplantation stage and you're actually not willing to go ahead with hair transplant, then yes, definitely we are at Max, we are providing with cosmetic hair systems also. That could be an alternative option for you.
What is the difference between FUT and FUE? Okay, this is a very common question which most of us come across, especially during consultation, because it's now this digital generation. People like Google and then they do their research and then they come for the consultation. So when you put hair transplant in Google, the first thing you're going to see is FUE, or you're going to see FUT. So obviously everybody's going to have this doubt. So doctor, would you like to explain what is FUE and FUT?
Yeah, I'll explain. At Max Hair we use the FUE technique. We don't use FUT technique. FUE is we take the graft, single graft, and then we make slits and we place it. FUT is they take it as a bunch. I mean, you have scars, but in FUE you won't have any scars. There won't be any visible scars seen in FUE technique, which we do in Max. But in FUT, they take it as a strip from the back. They completely take it, and you will have a scar. And they take the grafts from the strip, and then they'll place it.
So basically the strip will be seen,
at the back of
yes. And then there's sutures involved and stitching, and then there's bleeding, and then it's a bit more complicated than the regular FUE. The FUE is better, you will not have scars, just like the doctor was saying. So yeah, Max we mostly prefer only FUE. But FUT has got its advantages as well. You need a very limited donor. Especially female, you don't have to go for complete shaving. But in the long run, always FUE is better when it comes to FUT or FUE. You want to read something now? Yeah.
One of the followers asked us about various donor sites and which is the ideal one. The most ideal one is at the back, where we can take maximum number of grafts. But also if you have minimal donor, we can take it from your beard and also from your chest. But the most and precise ideal one is at the back. So we, if the donor is very less, but if you have a good amount of beard and chest hair, we can place the beard hair and the chest hair as a graft on your scalp.
What is so special about sapphire hair transplant? Okay, so yes, the hype.
The most awaited question.
Yeah, so when you hear Max, you hear sapphire. Max Hair Clinic is the most famous, most popular known for sapphire hair transplant. It is basically a tool which was invented in Italy but pioneered in Max Hair Clinic. We are the first ones and still we're the only ones in India who's actually going ahead with sapphire hair transplant. So it's basically a tool. Sapphire, you heard of the gemstone. So the gemstone is cut so precisely. It's cut so sharp with the diamond shape and it has a sapphire handle. The plantation, like in surgery you have two steps. Basically you have the extraction where we remove the hair from the donor, and you have a plantation where we'll be placing the hair into the affected area. So for plantation there is so many methods. You have your famous DHI, you have your IGM, you have a lot of other techniques in the market, but the most poised and the elegant, more sophisticated treatment would be sapphire, because we actually use the gemstone for it. It's so precise that you can make very sharp slits into the affected areas, and the slits can be so precise that you can place them so close to each other, and you would just be planting the hair into these slits. So since it is so precise, you can keep it very close together, and when it starts growing you would see the density is there. And obviously sapphire has its own antimicrobial properties, so there's very immediate wound healing, no side effects, no scarring, very minimal bleeding. There's a lot of advantages when it comes to sapphire. So we are very proud to be performing sapphire, and just seeing the results of how sapphire versus all the other treatments in the market, especially hair transplant, sapphire is actually giving very good results when in comparison, because of the way it is made.
And the most highlighted part of sapphire is that we can achieve density without damaging any of your pre-existing hair.
Exactly. You can give the angulation, especially gap fillings. Like you already have some hair, you just want to do the filling. It is so precise that you can give the slits between two hairs without damaging artisan. So that is a very important point when it comes to sapphire hair transplant. How much grafts are needed for hairline correction? This is a very vague question, I would say, because hairline correction depends on how large your hairline needs correction. It can be 4 fingers, 2 fingers, it could just be the sides, it could just be building a new hairline where you shorten your forehead. So actually hairline correction is a very vague term. But yes, if you're a male, then from your hairline I would be marking 4 fingers above. So keeping that as a reference, you probably would need like 2 fingers or 3 fingers for your hairline. And I wouldn't exactly be able to say you how many grafts, because graft and follicle, there's a huge difference in between, because follicle is a single seed where one hair comes out of it, but graft is a collection of 2 to 3 follicles in between. So based on how many hair you would be needing and how many hairs are there in a single graft, I will be placing in your hairline. So roughly I could say probably 2000 to 2500 grafts, but in follicles it can differ. It can be 5000, it can be 4000. That completely depends on your scalp. So this is a very vague question, but I hope I answered that question for you. Any other questions?
I think this is also already repeated. Is hair transplant safe?
Yes.
We had one of our followers who asked this question, and
this is interesting. Can a 72-year-old patient go for hair transplant? So, yes, we do have a lot of clients in their very young age of 70s and 75s, even a lot. I think that's the most highest, I think. Yeah. So it's completely safe as long as you are medically fit. We have a long list of blood tests, and ECG is very important. As you can see, our OTs, the complete setup of your complete monitoring, everything is there. So it's completely safe, you don't have to worry. As long as you are medically fit and you have a very good donor, you can definitely go for hair transplant, regardless of whatever age you are.
Exactly. You provide us with donor and we provide you with hair back.
Exactly. That's a very nice thing. We should keep that as our caption. Yeah. So,
There is a question.
Yeah.
Can others' hair be used as a donor? Can others have? It's like, transplanting kidney and liver.
Yeah,
It's like that.
I mean, it's quite complicated. It's no. I mean, it can be maybe in the future, but then you would be under immunosuppressants for a very long time. I think it's not that required. You can always go for your donor that is the best and most,
As we said, you can
yes.
take it from the beard
Yes,
or from the chest
exactly,
hair.
exactly. If you have good chest hair, you can go over thighs, calves, arms, beard. All these are good donors. And if you don't have good donor, you can always have scalp micropigmentation. You can have keratin fibers. You can have cosmetics. So currently, at this stage of the hair transplant, we are not going for other person's donor. Not yet, I would say, but yeah, science is evolving, hair transplant is evolving, so maybe in the future, one day we would take your friend's hair and plant it for you. Yeah. Can I use hair oil instead of hair transplant? Oh my god, the number of times we hear that.
And also about shampoo.
Yes, yes. No, oils and shampoos have nothing to do with you getting back your hair. Definitely oil is going to nourish your scalp. It's going to repair a frizz, repair a bit of damage, but it's not going to give back a lost hair follicle. And shampoo is just a clarifying agent. If you have dirt, it's going to clean it. It has no other property. Basically, it's just marketing. Unless and until you have a medical condition like you have dandruff, you have dry scalp, or you have some skin infection, or you have lice in your scalp, medical shampoo is going to help. Otherwise, just go for a moisture shampoo. It's not going to help. It's not a replacement for hair transplant.
Will my hair transplanted hair become white? So yeah, definitely the property that your donor consists, like for example, for a patient who comes with a curly hair where the donor is curly, definitely when we extract that graft and we plant it in your implanted area, like with your, in the front, so definitely the property it's going to carry out the same curly hair. You'll not get a straight hair growing from a curly root. So the same way when you
can straighten your hair though.
Yeah, we can straighten it. We have options of coloring it and straightening it post transplantation. You can style options. You have a various styling options that you can freely do it. But definitely we cannot give you a grey hair, take out a grey hair and give you a black hair as such. It's not magic. Hair transplant doesn't work like that.
I mean, people say gods are, doctors are like gods, but no, it's not. We are not like gods. God is God and we are human. So, I like this question. Someone named Sunita had asked me, what was your most emotional hair transplant case? So I would like everyone to answer this, and I'll start with myself. I think I had a client, I am not going to disclose his name or anything related to him, but just his story I would like to share. Because he had given the consent and he wanted me to be someone who talks about his story. And so he actually was into very depression. I mean, he was really, really sad because at a very young age he had lost his hair, and then that was because of a big emotional damage that happened in his family. So he had actually lost his hair, and that completely put his self-esteem down. I mean, he was not able to get jobs because of mostly his self-confidence. I wouldn't say, I mean, people wouldn't hire you based on your hair, but still it does put your self-confidence down. And he started isolating himself because his hair was looking bad, his patches were looking bad, he was starting to look older. So all these were actually putting him down, and he actually reached a stage where he wanted to end his life. So this was something really sad and touching, and that is when we were like, just screw things, screw consultation, just give him everything he needs. And like, it was an emotional process. The surgery went for about 12 hours, I remember. And we took the maximum donor and we planted it. We used Sapphire because even though he was not that affordable, but we really wanted to do this for him because he was really at a very bad stage. I mean, I personally took about this case, and my beautiful colleagues, they helped me out. And now it's been almost 7 months and he is really happy. He's gotten married, and yeah, he just met us. We are actually doing reviews these days, and he had come 2 days back with his new wife, and it was a really nice story. And he had shared us pictures, and probably we'll just put those pictures up on Instagram as well. So that was something which was really emotional. And when a patient tells you God bless you, it actually means a lot. So it actually was a very emotional case for us. I mean, apart from competition or whatever it is, you know, when you make that change in someone's life, it actually means a lot. And yeah, hair is something which defines you, and it boosts your self-esteem. It gives you that confidence to set out. I mean, you could wear the best clothes and the best accessories, but your hair has to be the right to look, you know, confident from within. So yes, we have done a lot of emotional cases in hair transplant, and I think that is what keeps us going.
So in my journey, I just feel that I'm connected to each of my patients emotionally. It's not just one case for me. I feel that I'm connected to them in either way, like with their story or with their profession or something or else. Like throughout the surgery, we keep discussing. We just talk to the patients. We make sure we interact with them. We make them comfortable. So we are at the point where we just get connected to everybody like that. Since we just give local anesthesia and the patient is very wide awake. So yeah, that makes sense for me because I'm like connected to everybody, like all my surgeries. So I don't have any special particular emotional case. For me, everything is special. All my patients are special.
Do you want to share emotional something, or you want to start crying?
No, definitely not. No, in my case, it was regarding the wedding, especially. You know, it was very difficult for him to get a bride, and he was almost 33 or something at that time, and they were searching for a bride for him for past 7 years or something. So that was his story. So it was nice to hear from them.
I mean, I think especially in India, people just want hair for the wedding sake. I mean, they get hair.
Yeah, we had patients who said that I'm just having this hair transplant done just for the wedding. After then, even if it sheds, I don't care. So just treasure it throughout your lifetime, not just for your wedding.
That's not a good perspective to have. I mean, do hair transplant for yourself, not for someone else. You get that hair for you, and don't wait for it to, like, you know, for wedding and then let it go. No, that's not a good thing. There's some questions popping up. I am planning for hair transplantation and started my own research as well. I want to know the success ratio before proceeding further. Okay, so success ratio of anything, any treatment, basically, it depends on the type of procedure you're going for, and who's going to do the procedure for you, where you're going to get it done, and how your medical or physical examination is going to be. So in Max, we have, just take hair transplant, we have almost all the techniques when it comes to hair transplant. We have IGM, we have DHI, we have Sapphire, obviously. And when I would say the success ratio, just the way how the procedure is done, the tools used and the techniques used, I would say Sapphire has the highest success ratio because there is zero damage for the hair follicle during plantation. I mean, like even DHI, say, okay, I'm no offense to DHI, but I'm just saying, like, DHI is a Choi implanter, right? So you put your hair inside the Choi implanter and you are going to punch it on your skin. So obviously the hair is going to pierce through your skin and enter. So there is a little bit of trauma, shock loss going for this hair follicle during the plantation. But when you talk about Sapphire, Sapphire is the gemstone which is piercing the skin, making that clear cut on your skin. Yes. So, and then you plant your hair inside, there's like zero damage happening. So your survival is very high for Sapphire and Sapphire Mirror Plus. Sapphire Mirror Plus is an advanced procedure of Sapphire. The tools are even more minute and precise. And yeah, the survival for Sapphire is higher if you ask us. How you're going to charge for each graft? I wouldn't go for anyone charging per graft because it's a very expensive and very vague way of charging you. I mean, yeah, so always go for a clinic where they charge either as a package or they charge for you per follicle. But charging per graft is not a good way because a graft can have 2 hair or 3 hair, 4 hair, sometimes even 6 hair if your donor is good. And if they're going to charge you so and rupees for this 1 hair and it has only, this graft and it has only 1 hair inside, you're actually in loss. So definitely don't go for per graft follicle charging. You can go for per follicle. In Max, it completely varies depending on the procedure you're going ahead for. So please do visit, and we'll examine your scalp, examine your grafts, and then we'll be able to give you a better number.
For PRP, how much?
How much for PRP? I mean, PRP, you have your closed cascade PRP. It all actually depends on which technique you're going for. In Max, we have all the advanced techniques. Like, we don't go for the open cascade, we go for the closed cascade technique. So it is towards the higher range. In Max, most of our clinical procedures starts from 1 lakh, but the proper estimate would be able to, we could be able to give you, especially after seeing your stage of hair loss, how many sessions you would need and what other treatment you would need along with it. So pricing would be a very vague thing if we answer it right now, because it's going to be completely different for everybody as per their pattern baldness.
Yeah, and I would suggest people to stop thinking about the treatments, like coming to conclusion that you require PRP and asking for how much it will cost. Just first drop into a clinic where you will be examined and see what is the actual requirement for you, whether it's PRP or OLT. So basically, just visit a qualified person to determine your scalp first, and then definitely we are all here to help you out, giving you the best treatment provided.
I think I'm almost done with my questions.
I have a question. One of the followers asked, is it a painful procedure? Of course not. It is not a painful procedure. You will be under the influence of local anesthesia, and it will be pain-free procedure. So it is not a painful procedure, and you don't have to worry about any pain. And after the procedure, post-instruction, we will give you medications. So it is not a painful procedure.
I mean, like, it's if it is painful, there's something wrong.
Either
your anesthesia is not working or it's not the right dose. So hair transplant is completely painless, it's completely safe. You will be completely conscious throughout the entire procedure. You can be on your phone, you can be talking to any of us. I mean, we have lots of stories.
You'll be completely awake during the procedure. You can chat with her also during the procedure.
I think people become really chatty during the plantation part. So it's not a painful procedure at all.
Definitely. We connect a lot with the patients.
Exactly.
So
Exactly. How many PRP sessions are needed for female pattern baldness? That completely depends on what stage of baldness you are. If you're in your initial stages, you would need, especially if you're going for the closed cascade PRP, you would need about 6 sessions. That is monthly 1 session, minimum 15 days, maximum 40 to 45 days, not more than that. But if you're in your extreme stages, just PRP is not going to help. You would need topical application and oral supplements. But basically, if you're going for closed cascade PRP, you would need 6 sessions at the most. What is this?
Can we take PRP every month? Definitely.
Why not?
Yeah. It's just, you can just keep maintaining your hair even after once your 6 sessions of PRP as a course is over. Even after that, you can just, if you're going for a trip where there's a change in water or environment, and you're slightly noticing any changes in your hair, definitely do drop in and take a dose of PRP, and then you can just leave.
I mean, it's just spa. It's like spa for your hair, and it has got all these wonderful benefits of regrowth and retention and thickening, and basically just healing your hair follicles and your scalp. So it's such a beautiful technique. And mind you, PRP is not just for your hair. You can use it for your face. You get that glow, that youth, that collagen formation, and all these are very beautiful benefits which you get out of PRP. So PRP basically is something which you can do whenever you want, however you want, whoever wants can do it. It's completely safe, organic and natural. Especially when you go for the closed cascade like the one we have in Max, it is completely safe and anybody can do it. Just a small blood test which would be required, and that's it. I mean, but I wouldn't recommend the test tube PRP though. I mean, I have seen results. I myself, I mean, if you check my profile, you can see me taking PRP. So, I've done my research. Test tube PRP hasn't helped me at all. Like, it is the diagnostic tool which they use, right? The test tube. So it kind of heats up during the process, so your growth factors and all are going to just get burnt in it. So I wouldn't recommend test tube PRP, like the ones which they give you 12 sessions, 24 sessions, all those are not going to work. So if you're going, do your research, you can come to Max, we'll help you out. We have almost all the procedures when it comes to hair transplant, every different varieties, the good ones, the bad ones, the expensive ones, the cheap ones, we have everything. So do visit us, we'll show you what closed cascade PRP is, and that helps. Yes, I had very bad hair fall, I mean all you guys know, like I used to get it done, I mean whenever I travel, so whichever clinic was closer to me, I would go to the Max clinic and get it done. I felt my hair loss stopped during my 3rd to 4th session. So until then it was drastic, and then now my hair fall is stopped and starting to get thick. It is little bit starting to regrow, like I can see the baby hairs here and there, but yeah, closed cascade has helped me. Especially because I travel and the water and the food and all has affected me very badly, and yeah, so closed cascade actually helped me during my 3rd to 4th session. I saw the results.
And we have a question that's popped out which says, why hair will become thin at a very early stage or early age of 21 or 22? Any precautions has to be taken, or what kind of food we have to take? Can we get back our thick hair back? Okay, so yeah, can I answer this question? So why hair will like, for example, there's something called as testosterone in your body. For even for male, we have a higher levels of testosterone, and for female, we have traces of testosterone as well. So what happens is that this testosterone hormone, it gets converted into DHT. Like I told you earlier, it's dihydroxy testosterone hormone, which will get accumulated underneath your scalp, which will create a barrier, and it will stop. It will cut down your blood circulation to your scalp. So that is the reason why your hair is starting to become thin. That's the earliest sign that that your testosterone level has increased and it's converted into DHT, and there's a lot of accumulation under your scalp, and that's the reason why you are seeing thinning. So it's not about the age. Even at the age of 19, we had seen patients from the early ages of 16 where after they reach the puberty, and we see these changes in their body. So it's not just the early age as considered as 21 or 22. We have seen patients even before that. So this is the reason why there is thinning in the early age as well. So yeah, the precaution that you can take is that definitely you will have to start immediately retention program. So there are 2 types of programs. So one is a retention program and there is a restoration program. So retention program involves where you can have regrowth. For example, this retention program, it comes in the early stages of your hair loss. So definitely when you see changes in thinning and breakage and frizziness, and we'll suggest you with retention programs. And definitely food will not give you a complete solution for this thinning. So yeah, there are dietary supplements that you can take along with the treatment as a retention program. So it's not just the food that's going to solve your solution, no problem.
Yeah, actually my next question is exactly what you said just now. Can I take hair supplements to stop my hair loss? So the thing with hair supplements is that you take it orally, right? And it is these small tablets. It's full packed with all these good supplements like vitamin B complex, D, C, A, E, and you've got your iron, zinc, everything is there in it, and all the good stuff and all the stuff which is not necessary as well. So the thing is, when you take it orally, it goes to your stomach, you have your digestive acids, and it is going to get digested, broken down into really small particles, and there's going to be absorption, and the absorption has to take place, go all the way up to your scalp, and then there you have your DHT blockage again. So oral supplements can only help you to an extent. I would say it would hardly be 20% of your treatment. But yes, oral supplements are not going to be harmful. I wouldn't suggest you taking it for the rest of your life, but you can take it as per your doctor's prescription. But instead of that, there's something in Max Hair Clinic where we call the mesotherapy, where we have these supplements being directly administered to the scalp. It bypasses your digestive acids, it bypasses your DHT, and it goes and nourishes your hair follicles. It improves your blood circulation, improves the absorption of this good stuffs inside your hair follicles. So that is a better option than actually consuming hair supplements.
I have a question. How many times can we do hair transplant?
How much of a donor you have left?
And we are ready for as many as we can.
Yeah, I mean, give us hair and we'll give you hair, just like how doctor said. But yeah, hair transplant, I would, jokes apart, hair transplant should always be your last option. You have to preserve it even before it starts getting damaged. I mean, we only go for treatment when we see there's a problem, but I would say go for something even before the problem starts. Like you can always have your, monthly hair spas, or you can have your 6 months once PRP or a checkup, or just go visit a Max hair clinic or any hair clinic for that matter. Get your hair checked, your scalp checked, and especially during the summers. I mean, I think India is mostly summer, so just go get it checked because there'll be a lot of sweating happening, and then you'll have your frizziness. So preserve whatever you have, and then if you're having any issues, start the immediate process. Like you always have your mesotherapy, like I was saying, you have your PRP, which is absolutely safe and painless, and then you have topical solutions, oral supplements. So go for all this and don't wait for you to actually start seeing your scalp exposed. And if your scalp is exposed, then your only choice is going for hair transplant, because then your retention is not going to work because there's nothing left to retain. And but if you don't have hair in the donor, then you can't go for hair transplant. So you can go for hair transplant as long as you have a very good healthy donor left. How useful and effective in side effects of Fenestrate? Fenestrate. I mean, it is a drug of choice. A lot of doctors are prescribing it. I know a lot of doctors prescribing it. A lot of my patients come and talk to me about it. But do we prescribe Fenestrate? No. We don't go to that extent. I mean, it is good. It's a very good drug. It stops your hair loss. It gives you that regrowth. But the mechanism of action, it reduces the testosterone in your body. So the mechanism of action is not the preferred mechanism of action, I would like to say. So it has a lot of side effects. It affects your sex hormones. So it has a lot of side effects. It changes your coarse voice. It becomes softened. Your facial hair reduces, and all that happens, especially for men during the prime time of their lives. So I wouldn't recommend Fenestrate. But I know that there are a lot of doctors prescribing it, but we personally don't prescribe Fenestrate. It has a lot of good stuff, it has a lot of bad stuff also, but we see the way and we go for the treatment which has more of the good stuff than the bad stuff.
Is taking treatment is the only way, or can't we get naturally without using any English medicines or treatment?
English medicine or treatment, I would say, would be the best path for you. I mean, naturally, I mean, there are a lot of stuff like, especially being in South India, we've been generations and generations, we have a lot of home remedies. We have, what are those, onions? Neem oil.
Using aloe vera.
Yeah, I mean, coconut oil for some matter, yeah. So there are a lot of home remedies, but the thing is, we are way past that stage, right? We are way past that generation, we are way past that kind of pollution or that kind of lifestyle or that kind of food for matter or that kind of stress. I mean, now the stress is too much. People of really young age are having a lot of stress. The world has become completely digital right now. It's too much for this. So I wouldn't say home remedy is going to help you. I mean, the kind of hair loss we see right now, you see guys in their 13s and 14s are going bald, and people till they reach the 30s, 35s are not having beard. So there is a lot of evolution happening right now. So I wouldn't say home remedies is going to help you. You can always try these stuffs are going to help you with probably nourishing your scalp and nourishing your hair. You will have a good texture. You can prevent certain amount of bacteria and all that with all these home remedies. But it is not exactly going to give you regrowth, or it's not exactly, to an extent maybe it can help you with hair loss, but it's not going to, it is not the treatment for you. Like say you put onions on your head, man, and then you sleep. it is going to get infected. Bacteria is going to come on your scalp. So I wouldn't, that is not a choice what I would go for. Home remedies is not the medication now, especially for this generation, for this kind of lifestyle. Yes, exactly. So always go for a scalp examination, get your scalp examined, your hair examined, go to a good physician and start with your basics. Start with your oral supplements, your topical supplements. PRP is always the best line of defense when it comes to hair loss. Taking another hair supplement question. Doctors are prescribing vitamins or mineral tablets. Does it help for better hair? Supplements are going to help it definitely, but it is not going to completely be the 100% choice. It is going to probably help as an adjuvant. Yes. Probably if you're taking PRP or you're taking an oxygen laser therapy or you finished your hair transplant for that sake, and then you take hair supplements, it's definitely going to boost in the growth, but supplements as such are not going to help. Yes. So
will the transplanted hair fall again? That was the question.
I think we answered it, right? So yeah, like,
because it completely depends upon the technique.
yes, yes, technique is very technically crucial, yes, and it is resistant to DHT, so it is not exactly going to fall because of DHT. But aging is there. Aging is a major factor, and as you grow older, your hair is going to thin, regardless of whether it is transplanted or pre-existing. So, but when you compare your transplanted hair, your pre-existing hair, your transplanted hair is not going to fall that fast. How safe is Max Hair Clinic? That's a very good question. I mean, yeah, as I was saying, we are here since 2004. We are in the market. We have a lot of competitors. I mean, everybody is doing a wonderful job. I wouldn't lie. But how safe is Max? I mean, we wouldn't be here for 18 years if we were not doing a decent job. I mean, yeah, so Max is really safe. All the techniques used are US FDA approved. All the machineries you see here are all imported from Italy. And we are all trained especially for hair transplant. We have a very sterile environment. All our hair experts are really experienced. Our consultants are the best.
Yeah,
and
I would really give a huge shout out for our consultants and hair experts who are here at Max, because I would believe that your basic examination, scalp examination, is the key to your desired look. So our consultants at Max, they are very much experienced. They determine your stages of hair loss and what is required for you, and they start with that, and then we take ahead what's there. So definitely, so Max is very much safe, so you can definitely trust us and do drop in for a consultation for your hair problems, and we are here to solve it.
what other post-op instructions after hair transplant? I mean, nothing much. After your surgery is done, okay, for 1 month you have a little post-op that you will be following. Like what shampoo to use and the antibiotic you should take, and how you should preserve it from sunlight, dust and pollution, or initial days don't go bang your head somewhere, or be careful with what you wear, where you sleep, and especially what you spray on your head. So yes, you do have a lot of post-op care that has to be taken. Keep it clean, a very important thing. Keep it clean. Don't let it sweat and oil and dust and all that. You can, that's a way where we say wash your hair after surgery, morning and evening for 15 days at least, every single day, but after like 3 days after the post-op, not immediately. Wash it so that it stays clean, all the scabs fall off, all the old hair sheds down. You have your shedding phase after surgery, and then you have your resting period, after which you have your initial growth. So until your initial growth starts, there are a set of post-op instructions. We have a protocol that has to be followed after the surgery is done. Antibiotic plays a huge role, and we have painkillers and all that. So yes, we have. What do you feel is the most important post-op instruction after surgery?
I would say following everything that we are asking. Because we have patients like calling us in the midnight asking that, ma'am, do I really need to sleep like this? Yes, definitely, because we don't want you to damage what we just planted. So please, just follow what we are instructing you with, whatever instructions that we are giving you, and yeah, we'll have beautiful results. We'll see a lot of bunch of baby hair growing within like 2 to 3 months, and we'll have a reviews, and then the story goes ahead.
Okay, there is, I think, a sarcastic comment. There is no solution for getting hair back without treatment, because some people are afraid to consult a doctor because we lose more hair if we consult doctor. What is your opinion on this? Okay, if someone had fever and they are scared that if they meet the doctor, the fever is going to get worse. I mean, this particular question feels like that. So, what do you feel you should answer for this? I mean, waiting for your own problem to subside and then thinking that your problem is solved is, I don't think, is the right way to look at it. If you always have an issue, not just hair, any issue, it is always very important to get help. It is very important to have that awareness and cut it off at the initial stages and don't wait for it to become worse. So I think yes, you do need to get a hair examined by a doctor, by a surgeon or a dermatologist or a trichologist, because it's always better to get an expert help than doing it by yourself at home. So I would say that is the most best way to go.
It's not just with your hair, it comes with everything.
Yeah, that's true. What is the difference between graft and follicle? I think we answered that. Types of hair transplant. There are a lot of types of hair transplant coming from your extraction to your plantation. Like extraction, like our doctor was saying, we have the FUE and FUT. FUT is the follicular unit transplantation and FUE is the follicular unit extraction. FUT is we take an entire strip from your donor and then we dissect your hair follicles from that and then we plant it. Advantages, you don't need so much donor, you don't need to shave it completely, you will get so much from just a little space. But disadvantages, you are going to have the large scar and you are going to, there is stitches involved and bleeding is involved. It's not that safe and it's a bit scary. And FUE is comparatively safe. So in extraction, you have FUE, FUT, and then you have your manual, you have your motor. In Max we use the motor, we don't use manual anymore because it's very time consuming. I mean, we have so many surgeries almost every single day. We have surgeries per day, we have at least 2 surgeries because we have 2 OTs in all our branches. So I wouldn't say you actually are doing manual and removing your hair one by one is the right choice. So we at Max do motor. When it comes to plantation, we have the IGM, we have DHI, we have Sapphire, we have Sapphire Mirror Plus. So there's a lot of options. You could always come visit and see what's best for you and go accordingly. I think I'm done.
I'm done.
Recommended shampoo after hair transplant.
Initial 1 month, go for something very mild. A baby shampoo like your Sebamed or your, what's the other one? Johnson shampoo. Yeah. So something very mild you can go. After your, this shedding is done, your resting is done, your initial stages are come, your scalp, your pH is maintained, it's not oily anymore, it's not dry anymore. After a bit of, that all takes about 1 month, okay? So until 1 month is done, until your scalp actually settles down and your hair is like okay to grow, till then go for something mild. After that, you can basically just go for whatever shampoo you've been using, whatever is working for you, whatever has been working all these years, that is the best choice to go. Sulfate-free paraben B is always a good choice. So yeah, those are the shampoos. We wouldn't exactly recommend any shampoo because
it's just a cleansing agent.
It's just a cleansing agent. I mean, whatever suits you, suits you. And if you have dry hair, we do have moisture shampoos and all that. So you can help. It does help. So as such, just the initial stages, you have to take care of it. Because it's your own hair, it's going to grow the same way how it was growing regardless of whatever you do. Just you have to give that little bit of push. That's right. So I'm done.
I'm done.
Yeah. So I think even our live is almost done. We have another just 5 minutes. But I personally feel this was a very good session. Yeah.
Yes.
I mean the questions were beautiful and we're done. Yeah. The questions were really the kind of questions which everybody asks, like you see, awareness about hair transplant is it's a good thing. It's starting to it's a very talked about question now. Like people start talking about hair transplant. Like first it was only the western side of the western country in the world. Like they were more concerned of how they look and what they wear and what hairstyle they do, or all the trending hairstyles and hair colors used to come in the western side. But India, for the past I think 10-12 years, India is starting to pick up, and I'm so glad that the awareness of hair loss is spreading, and it is a very important awareness, because hair actually plays a very, very huge role in your everyday life, especially your self-confidence, your self-esteem. All these gets really boosted up when you have the right hair, because hair defines you, obviously. Yeah, so talking about hair, I think we are all really proud to be in this profession where we can actually do something about it, because hair loss has been a huge pandemic for several years, even before the actual pandemic came. So especially after pandemic, oh my god, we did not talk about pandemic only. Pandemic has boosted hair loss like
so much.
Yes,
So many.
yes, a lot. I think this was a boom in our career as well. Like the post healing stage of COVID, I mean the recovery period, a lot of people felt hair loss was a very important factor. The treatment, the condition telogen effluvium was a boom during COVID, especially after the second COVID, I would say. So we actually had a lot of clients in the recovery period coming and getting the treatment done. We were able to give PRPs, because plasma therapy was a very high on recovery period after the COVID. So yes, COVID actually did boost a lot of hair loss. People who did not do any treatment after COVID, they got their hair back, but not to the fullest, I would say. Yes, a lot of hair loss. I mean, if you see the statistics globally, COVID hair loss has been a major hit in the entire world. So hair loss, yes, hair loss has been a very big issue for men, women, older, younger, all kinds of races. So getting it done at the earliest, fixing it, solving it, actually going to a clinic and examining your health to see whether you have some issues, I think that is the first step in anything. I mean, it's never too late. You have your cosmetics, you have your scalp micropigmentation, so it's never too late, it's never too early. I think hair loss is an issue which is not much talked about, but it has to be talked about. It is not something you should be ashamed of. So anything else you want to say regarding hair? I think this was a very beautiful session. I did not notice 1 hour was gone. Yeah, so I think we should do this quite often. We will be doing this quite often. At least we would try to do this monthly once. The issue we have is we are always packed with surgeries. It's really difficult for the three of us to get together, but we will be doing this more often now, because seeing the kind of comments and the questions that people have been putting out, I see the awareness is spreading. So we will be taking this step continuously, and if you have any more doubts, or if you have missed out this live, we will be downloading this and we will be resharing it on our YouTube and Insta page and Facebook and whatever. You can go through it. If you have doubts, please do visit Maxa Clinic. We are in Chennai, Bangalore, Hyderabad, Mumbai, Delhi and Coimbatore. We are coming up in a lot of other places as well, and we are growing, and it is a very beautiful journey for all of us and our clients especially. So please do visit us, or you can DM us, you can call us. Our comments, our contact numbers are all visible and available for you. So yes, that's it. Thank you so much guys for taking the time and coming. Hyderabad location name, okay, we are in Jubilee Hills. Oh my god, so many questions now. Yeah, in Jubilee Hills, in Bangalore we are in Indiranagar, in Chennai we are in Nungambakam, and so on. Yeah, you can just go through it. We have a lot of clinics, so please do visit, and happy Sunday guys.
Happy Sunday guys.
Happy Sunday, guys.
Thank you.
Thank you. Bye.